Hello everyone, welcome to the session on mindful motherhood. We will be having Dr. Rupali and Dr. Ruhi joining us shortly. Hey, hi. Hello everyone, thank you so much for joining.
Hey,
Hi Vidya.
hi. Yeah, how is my voice sounding? Okay?
Good. Yeah, it's good.
Okay, okay.
Okay, just let's
That's right.
wait for Dr. Ruhi and Dr. Rupali.
Sure, sure.
You want to talk something about the session? The first
Yeah,
one?
I can. Shall I start?
Yes, maybe you can talk about the session, what it is about, and
Yeah,
we'll wait for Dr. Ruhi and Dr. Rupali to join, and then
sure.
we can introduce them.
Yeah, definitely. So, hello. Okay. Should I hold it like this or this is
Better.
good? Better. Okay. Okay. Hello, everyone. Thank you so much for joining us today. So, we are going to be talking about mindful motherhood. That is the upcoming workshop from New Mother in collaboration with Dr. Ruhi and Dr. Rupali.
Hi,
Hi.
Dr. Rupali.
Hi, good evening. How are you guys?
Good. How
We
are
are
you?
good. We are good.
I'm
How
fine
are
as
you?
well.
Okay.
Nice. I was just going to talk about mindful motherhood.
Yes, tell
Yeah.
me.
Yes, so mindful motherhood workshop. This workshop is going to be, to emphasize the importance of physical health and mental health of new mothers. It's more to do with the new mother. We are concentrating only. Hello, Dr. Ruhi.
Hello,
Hi.
hello. How are you?
Good. How are
We
you?
are good. We are.
How are we vibing? Very similar. Look at me and Rupali, and look at you and Ruhi.
Yeah.
Ah, connecting the
It looks
vibes.
like we are sitting in the
Good.
same house, different rooms, you know. I was about to ask that to you.
I agree. So cool. Yeah.
Nice.
Good.
Yeah.
Yes.
I was just telling about our upcoming workshop.
Sure.
Dr. Ruhi.
Go on.
So mindful motherhood is more to do with the importance of physical health of the mother and mental health. It is to show new mothers that their health is equally important along with their baby's health, and their physical as well as mental health is important. And we want to let you all know that, instead of attending guests at home after the childbirth during the first 40 days, please concentrate on your health. That is
Yes,
very important. Utilize that time for, your physical and mental health. This program is for pregnant mothers and this workshop can give you the confidence, of childbirth and your postpartum period. That is your mainly the first 40 days after childbirth. And the confidence what I'm talking about is that you are a mother to your child, not associating with any titles like good or bad, nothing. You are a mother to your child and you know how to take care of your baby. Okay, so that is what we are concentrating on, to give the confidence to mothers, and that is
yes,
very important. Many of us, feel guilty in the later stages. In this program you can learn uh, from the experts who are mothers themselves, and they are new mothers. Okay,
Yeah.
yes,
so and moving on to introducing our guests for today, and they are going to be the ones who will be leading mindful motherhood. So I'll be starting with Dr. Ruhi. Dr. Ruhi is a consultant psychiatrist and a counseling therapist. She practices in Divine Mind Clinic and House of Cure and Cloud9 Hospital in Mumbai. And she specializes in expertise in anxiety, relationship issues, addiction in medicine, and then pre and postnatal mental health issues and depression. I think we don't need anything else. Everything is covered in this.
Yeah.
Yeah, and just to add on to this, and we know that there is a stigma attached to mental health, right? We know that people don't want to go and talk about mental health, even to approach an expert. They feel, so they have a fear attached to them, attached to mental health and anything related to that. So if I get a fever, if I have fever for 2 days, if it doesn't reduce, I'm okay to go to a doctor. But if I feel low in my brain or mind, I don't want to go to a doctor. I'm like, no, no, chalega, it'll be all right. So, what a better place to attend a workshop from psychiatrist herself, so that you will know that how friendly they can be, and you can open up yourself. Only when you open up yourself, you can, and I mean, you can get solutions. You will know that it is okay to approach a psychiatrist, and you will know it's okay to get counseled. So this is the best place where you can gain this,
Right.
to interact with the expert herself. And moving on to Dr. Rupali, she is a consultant physician and a diabetologist. She runs her own practice in Karma Advanced Clinic and Cloud9 Hospital. And we recently had a live session with Dr. Rupali regarding gestational diabetes. I want to highlight on that in the recent years there have been many cases increase in the gestational diabetes in pregnant women. And just to highlight the issue, it's not just because of genetics. It is easy to blame our elders. Yeah, my mother had it, my grandmother had it, so I'm going to get. No, no, no. It's not like that. It has been made very clear. You can go and watch the live session. It's on available on YouTube. That genes alone does not is not responsible for gestational diabetes. Your lifestyle habits matter a lot. And on this point, what better place than to learn about this from diabetologist herself. So she will be there to guide you. And yeah, I forgot to mention this, that having a gestational diabetes can have an impact on your baby as well. It's not that you should get worried, but you should know that since the baby is inside you, what you eat and how you are matters to the baby inside. So yes, so we are very
Thank you, dear
happy to yeah,
Dr.
associate
Ruhi and
with
Dr.
Dr.
Rupali.
Ruhi and Dr. Rupali. Thank you so much for joining us.
Thank
And
you
over
so
to
much
you,
for that
Nilofer.
lovely introduction, Vidya. That
Yeah,
was
thank you so much
elaborate
for
and
an
that was
elaborate
really good.
introduction. Yeah,
Thank you so much.
Thank you,
Welcome,
thank you.
Dr. Ruhi and Dr. Rupali. We are like,
thank
Vidya
you.
has already expressed in her talks. We are more than happy to have you both with us.
Yeah.
Before
Right.
starting off with the first question, uh, I just want to mention that one scene wherein it was the first time I was talking to Dr. Ruhi, and although it's like, yeah, new mother, like, Vidya and I are the key people driving new mother. But the first time I spoke to Dr. Ruhi, she was like, this is something that, Rupali, my sister, and I have been like thinking about doing from ever since we had our babies. Okay. And she was so
Yeah.
excited, so excited. She was like, I don't want to listen any further. You don't really have to convince me, stop it. Like, she listened to me because I was talking, like, non-stop. And she was like, no, this is something that is really needed. This is missing. We want to do this. That was the kind of enthusiasm Dr. Ruhi had, she still has, and Dr. Rupali has. So we are so happy to be associated with you. We are so thankful that we met you, and we are running this program together.
Right.
Before moving on to the first question that I have, if y'all want to add on something, Dr. Ruhi and Dr. Rupali, y'all can add, before we start with our questions.
Right. You want to go first or shall I?
Dr. Ruhi, please.
All right. Thank you. Okay. So wonderful that we all are together. This is actually more of an emotional investment on my part rather than professional. Me and Rupali, of course, we are sisters. Then we are doctors together. We graduated together from the same college. And today we see patients together. We work together in Cloud9. And, any patient that comes where I feel that there is some physical aspect to it, it is her that I consult. Or, whenever she sees there is some mental health aspect going on with a female, I am the one she differs too. So this has always been a collaboration with both of us, right? But then we became mothers almost together. I was 6 months later in the journey. And that is when we actually realized the need of such a program. So see, we both are doctors. So theoretically, we had the knowledge that we required. I knew most of the stuff. She knew most of the stuff. But the level of dependence that I had on her or she had on me was something that was, surprising. And one thing that we used to discuss often is that we both are doctors, we know so much, and yet we, have so many questions when we are pregnant. In the middle of the night, I'll see my baby, breathing a certain way, or while I was pregnant, I'll have a certain movement and I would question it. And she is the one I would message, and having her, I think I was blessed because it kept my anxiety at bay. I didn't have to worry of what will happen because I just knew that I just have to ping her. And I have never been, I'm the elder one in the family, so I am the one who is always in control of things, in my head at least. But during the pregnancy, it was her. I just switched off my brain. I was like, I don't care what is happening. If anything happens, just handle it. I literally know that once my baby came, I was so nervous in cutting the nails also. So I called her that, now his nails are long. I don't have the strength, hold those baby fingers and cut the nails. She would come and cut them for me. And I didn't trust it, and especially it was COVID at that time, and I wouldn't trust any nanny for my baby because the way they handle was not something that went well with me. So, if we have to, hair are longer and, there would be some skin thing going on. My baby had a lot of issues. If I would go and read about it, I would panic. So it was her, I would literally just send her the picture that tell me what to do. I don't want to put my brain. So leave the doctor thing aside, leave the knowledge aside. Having that level of emotional support itself changes the whole game for you, because all I had to worry about is how much I do love my child, right? And then we had two babies growing. Hers is only 6 months apart. So that is literally my firstborn. I don't see any difference between both the kids. So having two babies and seeing them grow in a similar pace, it is amazing. It's amazing. It's the journey itself is so amazing, and it helps so much because she knows something already because her baby is a little bit bigger, so she can guide me there. So that's why when we were anyways in works of it, that we need to create a product like this and we are going to work on it when you contacted me. So it's actually funny, when we left her call, she was so excited about it, she wouldn't just stop talking. I remember I was in my kitchen and I had to switch off the burner because she was on, and I was like, I cannot stop her. I knew everything that she's going to say next, but I was like, I can see. And that was the reason that I joined you. It's not that you guys were the only one who contacted me for something like this. I have been doing workshops for almost like 3-4 years now. But the enthusiasm, the energy that she had, that, we will do this, we will do that, I want to do this, I want to do that. And I was like, after she finished, I was like, Nilofer, you didn't have to go in details. Just with the energy, I knew that we are doing it together, and I think that we do good work, not just with the right intention. We need the right resources as well. Right? So me and Rupali have the knowledge, but then we are not very tech savvy. And to be honest, time element is also big in this because we both are working, we both have babies. So you guys coming in and taking away all the stress of the rest of it that is required in running such programs makes it possible. Otherwise, I think it would have taken another 2 years to be able to possibly, materialize it. So that's the excitement part in this. And then of course the intention. We all are new moms, so that's the purest intention of all, right? Mother can be anything to anybody, but she's always the best thing to their kid. So Vidya said a very interesting thing that you are the mother and you need to get that confidence. I think the confidence comes from the knowledge, right? I can, like I said, I had all the knowledge, but to be able to decide that, okay, I am doing the right thing. I had an expert. She's my sister, yes, but she was the expert telling me that whatever I'm trying to do here is right. And to be honest, when you are a mother, no matter how much you know, you always have those insecurities, you always have those doubts that, I just hope I'm not messing up this little thing that I have in my hand. So that is why when you contacted me also, one thing was that, we'll run a program where we will teach people. I also mentioned the community part of it, that, we don't want that we are coming here and just telling you the knowledge. Half of it you can find on internet. Yes, I'll, give it differently. I'll make it, practice it differently. But then the aspect of having us with you throughout the journey, right? That's something that I want to create here. I want to make sure that all the mothers have the support that they need, and the right support, not just any support, right? I see a lot of these online portals where we have these question answers, and it's great that, we have that access today, which we didn't earlier. But then I see a lot of answers that are given, they're like very cringy, and I know sometimes they're damaging as well. But of course, I can't go on and, keep on correcting everybody. All I can do is my part. So that was the whole intention behind creating something like this and getting all of you together. And the best part is that, I get to work with you. And again, with my sister, I think this will be like a permanent collaboration with her, which will give us some time to talk to each other, to be honest. I think after so many months we have done this, that we called each other and asked like, okay, what are we wearing? So that was too much fun. We were cutting it. She was like, okay, I'm the cream coat. I said, okay, should I go cream or black? She was like, no, you go black. I said, fine, it is black. So I think after so many months, we always used to do this, but it's been months since I did that. So I was already, having a smile before starting that we are going to get together. So I'm really happy that we are doing this. It's sheer pleasure to do this. There is no professional thing going on in my head. It's very, very heart driven and very, very, sentimental thing for me that we'll be able to do this.
Completely.
Can
Thank
sense
you
your
so much.
energy.
Thank you so much, Dr.
Yes.
Ruhi, for pointing that out. Like, I keep watching you guys, mostly online, and then I'll be like, amazing, amazing, really amazing. You guys have lovely, lovely, lovely relationship, and I just wish that, yeah, it stays the same always and always.
Yes. Thank you.
Thank you.
Yes. Go ahead, Dr. Rupali. You want to
Yeah,
put
Dr.
something?
Rupali, if you have anything to say.
Yeah, so I have met you guys through my sister, but then the work that I've seen you guys have been doing, so all the reels that you share, all the content basically that you are sharing, that is actually really, really, really informative and it's very authentic. So I think that is a very good thing that you guys have been doing.
Thank
Plus,
you.
the reason why I wanted to do this, that I had joined some pregnancy app when I was pregnant. There's a community in all the apps where you can ask questions, the doubts that you have. So there I realized that many females, even if they were pregnant for the second time, they still didn't know why they were vomiting. Was it normal or not? Even the basics of the things of pregnancy, because pregnancy goes from head to toe. It changes your entire body, be it your hair, your skin, your teeth, abdomen, everything will change. But they didn't know even the slightest about the changes that are going to happen. So that's when I realized that it is so important that we tell all those ladies that what things are normal and which things they should be alerted about and they should go to a doctor, and what all things are to be taken care of, so that they don't have a problem later on after the delivery and even in the next pregnancy as well. So that is why I wanted to deliver all this information that I had in my head, but then the source was not there. So finally, you have been the source where I can just take it out. So I'm really glad that we are doing this together now.
I've been
Thank
so
you.
happy in a live session, I guess, for the first time. I'm so happy. This entire discussion is so energetic and positive. Yeah, lovely. I'll start with my first question now. Okay.
Sure.
We have already spoken so much about mindful motherhood, why it is needed, what are the different things. But, this is the first time, I think, wherein, like, doctors have been themselves so enthusiastic to come up with a course with the ultimate intention for benefiting the pregnant women out there. Okay, like, really talking to them, being with them, supporting them throughout their journey. The program that we are about to launch on mindful motherhood, called Mindful Motherhood, it's basically focused on, like, the entire 3 trimesters of your pregnancy, through birth and then also into your postpartum period, giving a glimpse of your postpartum period. So this is something really fantastic. There might be other programs out there, but then, the kind of enthusiasm that is there over here is driven from the two doctors who are who will be leading that program. So how do you think this program, Mindful Motherhood, will benefit the pregnant women who will be joining it?
Right. Shall I go?
Yes.
Yes, ma'am.
Okay. All right. So basically, what we are talking about here is, first of all, understanding all the aspects of pregnancy. Like Dr. Rupali mentioned that, even the basics of pregnancy, sometimes people are not aware of, right? And that is due to various reasons. But what you cannot get into a journey without knowing what you're going through, right? Because in the process, you're first of all yourself anxious. You're making everybody else anxious, and the whole journey, which can be a beautiful thing and something, of to be remembered for a lifetime, just becomes chaotic, right? So the first thing that you need to do is understand what you're going through. Every trimester, what are the physical aspects of your pregnancy? What are the mental aspects of your pregnancy? I'm going to talk about the mental because that's my part. So many times you see, once you're pregnant, you have to work towards the acceptance of being pregnant first, right? It takes time to now see what has happened to me. Then, how to settle in that new environment. What are the changes that are happening according to me? The anxiety, that stress that it takes, the family pressures that it takes, your relationship changes with yourself as well as your partner, right? These are all the aspects that you need to work on. Apart from that, your connection with the baby, right? So having some practices which keeps you connected with the baby, having that mindset of there's another life inside me, it's a beautiful thing. There are literally no words that, even after all of us being mothers, I don't think we can ever justify the feelings that we had. So it's important that at that time you have some tools in your hand to keep yourself positive. You have some tools in your hand that if the anxiety comes up, if the emotions are overwhelming, there is sleep deprivation, there is, emotional dysregulation, you should be able to manage them. You should not be depending others for that support, because yes, others are there, but if you don't know what to do with yourself, how is it possible that anybody else know, right? Then of course, the second part of it, which is postpartum blues, postpartum depression, anxiety, all these things, because first of all, we don't understand what they are. And many times what happens is the symptoms start, the patient is suffering, she doesn't know what is happening with her, there's nobody around supporting her. By the time she reaches, it is already too much of, burnout. Already she has gone through so much that recovery takes even longer, much more stress during that, and much more, energy to come out of that phase, because it's not easy once you have a mental health issue, and let alone having a disorder per se. Just a day-to-day thing with a newborn, you are not sleeping. I don't remember, it's been more than 2 years since I slept the whole night. I don't know how I'm functioning, right? Before, in my grad, I was such a sleepy head. One night, if I have to pull up a little bit of study, and the next day I'll be like, oh, my head is cranking. I don't know how I'm functioning right now, but this is the power of now. Night over, and we'll be like, okay, we have worked so much, and this just gets recognized. You realize that what is your power, but then the other person doesn't. So many times we see there's no support from the family members. You realize what you are doing, but not having that recognition, not having that type of support can put added pressures. So I want to talk about all of it: how to manage yourself, how to manage your partner, how to manage your extended families. Like Vidya was mentioning, we have, instead of meeting the guests, just take care of yourself. But is that so easy in our country? I see half of the
No.
struggle just starts there. Half of the fights in the couple starts there, that this goes on in my family, it has to be this way. And she'll be like that, I can't do it. So these are all the things which make the journey very, very chaotic, whereas it should be the most beautiful journey of your life. So that would be my part to how to take care of this, giving you the tools, giving you the skills, and of course the backup, because we'll be here throughout the journey with you. That would be my part in the workshop. Dr. Rupali, take it over.
So now the major part, that is the mental part, that has been covered by my sister. So I'm left with the physical aspect of it. So, but then what to do with it is, first thing is to understand that how actually the pregnancy goes on, just to get an overview of what all things you are going through. I think Yes, many people do come after being pregnant, but if somebody will be coming before getting pregnant, that would be even better, because in that case, we can make them understand what they are going to deal with for the rest of their lives. Because I always say this to everybody that once you're a mother, you are a mother for the lifetime. You cannot say no to that responsibility. So one should be aware of what they're going to get into. That is the first thing. And plus, we will be discussing in details as to which trimester, what all things will be changing in your body, what you should be expecting and is normal, and what again you should not be expecting, and you should go to a consultant or a doctor for that. Then the other thing is that many people come to me that earlier days, their mother-in-laws or families will say that these many tests were not required. Why are you doing so many expensive tests nowadays? So that is a very contradictory thing. Then the females come to us and they say that the family is saying no to certain type of tests or so many sonographies. That is it really required? So these all things we will be covering in the workshop to tell them why is it important in this trimester, what are we looking for, and how it will help you. Plus, then the other thing that we will be discussing is the entire nutrition and diet, because it will be changing as the baby will be growing. So the requirements and the needs will be increasing. So we have to discuss about that in details. Additional supplements, whether or not required. So all these things are important to be discussed in order to have a healthy baby in the life. That is one thing. Plus, we will also be discussing about all the types of certain disorders that you get during the pregnancy. Some you will be getting recovered post delivery, and some will be going for your life as well. So, all those things are important to understand, and how to prevent it, it's most important. So, all these things will be covered by me, and I'm sure that we will be able to prevent many of the issues if we will be guiding you properly throughout the journey.
That was okay. Dr. Ruhi has been disconnected. I'll just connect her back once she joins. So,
Yeah.
you very rightly pointed out, Dr. Rupali, that was something like, one keyword I would say, preventive,
Yeah.
preventive things that you can do. You don't really have to wait for some issue to crop up and then, like,
Yes.
have a kind of reactive medicine on it. Okay, because what we are trying to do through this session is we are trying to prevent the issues which can be
Yes.
like easily handled, which do not really have to be blown out of proportion, and then, like, you have to eat up so many medicines to, like, control those things. So that's what we are going to do. And one beautiful aspect of this program will be that we are combining the physical and the mental health together. Okay, and I
Right.
really feel, for me, that is the most important part, because most of the women end up neglecting their mental health, thinking that,
Yeah.
mental health is nothing. If something is wrong, it means just that, you are thinking something, like something is wrong with you. Nothing is wrong mentally, like, you are fine, but then, something is wrong with you only. You as a person only is something wrong. That's
Even if the
what we
mothers
end up
will,
thinking.
even if the mothers will understand that something is wrong, their family won't understand.
Exactly. Exactly. And
They
that
will
will
get too
ultimately
much
lead,
sensitive.
yeah, that will ultimately lead to that person questioning herself,
Yeah.
what's wrong with me? So this program will be like, really beautiful in understanding this important part of pregnancy and postpartum, that mental health is like, it's equally important as much as your physical health, because only if you're
Right.
mentally fit, you will be able to go through your entire pregnancy, like, in a blissful way. You will be able to take care of the baby in your postpartum period and throughout your life in a much better way than, if you're suffering through something, like something is going on in your mind and you're not catering to it. So that is one beautiful thing. The next question was what can be expected from the program, and we have already answered that. So
Yes.
maybe, yeah, you can switch over to the next one.
Yeah. I'll take up the fourth question. So I've heard programs, where they say that we'll train the baby when the baby is still in the womb. I I personally feel there's nothing wrong with the baby. It's only the elders who need some training, because the baby is just fine. Baby, when even after the baby is out, the baby is still fresh and new. It's only the elders who are around the baby needs some training. So what is your take on such programs and on this concept?
Okay. So I agree with it partially, but I disagree as well. There are studies which show that even when the baby is inside, because they are growing up, they are developing, the nervous system starts, functioning and growing in that age as well. So, of course, we can't train them to be whether they're going to be a doctor or engineer then. But yes, we can definitely create an environment which is healthy, right? So, for example, see, you have to understand it in a very simple way. We take nutritional supplements because we know it's going to affect, right? We know that it's going to be better for the baby. Similarly, there are mental health practices as well, right? But that does not mean that there is some practice that if I do right now, they're going to become a doctor, nothing like that. But definitely, if you can work on yourself, if you are calm, you know that the baby is going to be, peaceful and calm in themselves. And our environment, there is one thing as biology that, okay, whatever genes I'm passing, my baby is going to be that person. But definitely the environment matters. So that's where I agree with Vidya that people around need to be, trained, need to understand how to take care of a baby. I'll take a very simple example, but you'll understand the impact of it. Okay. This is a very basic thing that when a baby is born and we give them a bath, right? So, the Indian system of bathing, right?
Yes.
So her baby was born first, and the first time she was being bathed that way, the baby was crying, and I was online. And I was like, "What the hell is happening?" And I told her, "Just stop, okay? Don't do that, right?" And she was like, that's what they say now. All these nannies ऐसे ही करते हैं, हड्डियां strong हो जाएंगी. I don't know, हड्डियां टूटेंगी या strong हो जाएंगी. It was horrible to watch that, okay? And then I told her not to do that, but it was a struggle for her because, like we say, the extended family feels that's the right thing to do. It was a struggle for her. So when my baby came, I was already prepared that this is not happening, right? So I took over, and my baby, I think maybe the first or second bath my mom gave. After that, I have been bathing my baby. And today, her baby stands out of the tub and just like baths like this. And my baby loves bubbles baths. So that's the impact, What we need to understand is such simple thing as this can be traumatic for the baby. Whereas if you take control and do it the right way, it helps. It makes a difference. But I also learned, because this was happening in front of me and I had that moment to learn. So this is a very simple example of one. And see, something as mundane as having a bath every day, if that can have an impact, imagine if we actually took care of bigger things in life, right? Our babies are just, she is almost 2, mine is 1.5. They are reading already. Mine does yoga as well, right? So what are we
Absolutely.
doing? What are we doing that, that's helping the babies? So it starts from inside. I remember in my pregnancy, as well as her, we used to do a lot of these breathing exercises. We used to do yoga. We used to do mindfulness practices. I would tell her that, try this, it would help. She would tell me, do this physical aspect of it. For example, I had bad migraines and backaches. So she was the one who told me, what were the things that were required to manage the backache or for my migraines. And to be honest, in rest of my life, I had more migraine attacks than my pregnancy, thanks to her, right? But that's because I had that access, right? So that's what we are talking about here. So yes, there are things that we can do even when the baby is in us to make it better for them. We can create that supportive environment and we can start preparing. So, but yes, I do not have any technique to guarantee that your kid is going to become a doctor or an engineer. But yes, I can definitely help you connect with the baby more, have your emotions aligned, and of course, be prepared with what is happening and have a peaceful pregnancy. Enjoy the process yourself as well as the baby enjoys that. So that would be my answer to it. Go ahead.
For me, I think that social media, yes, it is a boon that we get so much information, but then there is so much of wrong content there that it creates such confusion in the brains of the lady. For example, daily you can see a lot of content that do you want a super genius baby? I mean, really, how can every baby be super genius? Then they will have to change the definition of genius if everybody will become genius. It is not possible to have a super genius baby. So, and you cannot do anything about it when the child is in the womb. So there is so much pressure on the today's generation that their babies have to be expert in whatever they will do. They have to be number one. So that is why they do all kinds of stuff. that so that the baby comes out and the baby is a genius the moment she or he comes out of the womb. So that is what the main issue is. That's why all the people follow these things that are on the internet. But I do believe that environmental stressors do play a role, because there have been various researches that if the environment around the mother is stressful, so it is basically hormones, right? So she will be having those types, the stressful hormones in her body, which definitely impact the child when the child is in the womb. So that is actually true, but no, you will not have a super genius baby by doing anything in pregnancy.
Yeah.
Yeah, I just want to add to whatever you all said, Dr. Ruhi and Dr. Rupali. You know what I feel, I'm not an expert, but what I feel out of my own experience is that babies reflect us. So if
Yes.
we are happy, we are blissful, we are peaceful, either during our pregnancy or even after the baby is here, that is what is going to be reflected on the baby. You know, if I am crying, my baby is like, he is very cheerful. But if I start crying for whatever reason, he just stops, drops everything. And he is like, in that kind of state. He's like, what happened to mama? Okay, he is 2 years old now, so he can like interpret a few things. But I have been observing this, since a long time. So basically, babies are, they absorb emotions from the surroundings. They can understand what their mother is feeling, especially what their mother is feeling. And as Dr. Ruhi said, throughout the program we are going to talk about so many things, how you can handle the environmental factors, so that
Yes.
you are creating a peaceful environment for yourself. Why be dependent on somebody else, like thinking that my mom is going to come and then she is going to create that kind of good environment for me? What if that doesn't happen? You are there for your baby, so you take up that responsibility. Learn. Knowledge is the key to everything. If you know about things, automatically that pressure, that stress will be reduced, and you will know the right way in which you can approach, if at all any problem occurs to you, either during pregnancy or after the delivery. You will know what to do. Okay, because you know that, oh yeah, I attended this program, and yeah, this was what was said. And even if later on you want to come back to Dr. Ruhi and Rupali, of course you can come back, but then you
Okay.
will have that knowledge. So that confidence that will be built in you just by having that knowledge will be immense. And trust me, you will be able to, like, traverse through your entire motherhood journey in a much better way than you would
Yes.
without any knowledge. Because then you would be stuck, oh, baby is doing something, oh, something is happening to me, okay, pick up the phone and, like, I'm searching all over the internet. And internet is good and bad as well, because a lot of advice on internet is something like, I don't know, something like, if you even if you're having a small little illness, it can make you feel that you're having some kind of big disease. Okay, that is
Yeah.
not the right way to go towards it, to approach it. So it's better to prepare yourself in advance. As Dr. Rupali mentioned, that even if you're not pregnant, you're planning to get conceive, in the near future, that is the best time. But even if you
Yes.
have conceived, you are pregnant, it's not late. You can still learn about things. You can still plan for yourself. Okay, everything will not work out as you want it to. So when Dr. Ruhi and Dr. Rupali are going to share, their knowledge with you, and they are going to give you so many insights, that does not mean, oh, okay, this was said, so this has to happen in this way. No, entire journey of being pregnant and having a baby is unpredictable. The thing that can happen is that you will be confident, you will know how to navigate it, because you will have the right knowledge. Right knowledge is important, coming from the right
Yes.
place, from the right people. That is very important. With the right knowledge, you will definitely be able to take good, better, decisions for both you and your baby.
Yes.
I
Breathe.
just add one thing here, that of course, we are talking about new mothers and pregnant and the people who are planning. I would also say that it would be fathers who are, and
Yes.
especially today's generation, the definition of father is entirely changed. I know that what my mother tells me, how much handy, how much my father knew about the baby. So after my baby was born, my father held him like this. And I was wondering how he used to hold me. He doesn't know anything about taking care of a baby. But I look at my husband and he's literally like, better than me sometimes. He can do everything except the feeding part. So for the fathers as well, this program could be equally beneficial. And you can come and you can learn what happens to your wife, knowing what your partner is going through, knowing what are the things that needs to be done in that moment. Because sometimes the mother is so overwhelmed that she just forgets that this is happening to her. I know many times I was going through something, and it was my husband or Rupali coming and telling me that, see, this is happening to you, this is what you need to do right now. And I'll be like, yeah, I never thought about it because I didn't have that awareness in that moment because so much is going on. So if there are some new fathers, who are excited to know what is happening with their wife and what is happening with their baby, I think this program works wonderfully for them as well. And to be honest, the exercises that we'll talk about are as good as for the males as well. So nothing, nothing like I can't do it or it's just for the females. So if you are an enthusiastic father who is excited about your baby, I think we would love to have you as well on board.
Strongly recommend this thing, and I completely missed this point, but it is really important what Dr. Ruhi just pointed out, because it is really needed. It's not only important, it is needed. It is like, you have to do it. I encourage all the women who will be joining this program, please get your partner along, okay, because it will help you. If your partner knows what is happening, because most of the men, of our generation, I can say that 99% of men are raised, still raised. Maybe I may not, maybe I will not be raising my son in that way, but then I can say that my husband was not raised in the way I will be raising my son. Okay, so it's not negative, it's nothing bad. That was the way things were when we were growing up. Okay, that was just the way society worked. So most men do not have that kind of understanding or knowledge. They've not grown up seeing their dads helping their moms, as Dr. Ruhi pointed out. Okay, so that was just like, a woman's job, and this was a man's job. But we live in a different world altogether, wherein we are talking about equality. We are practicing equality at our homes. Okay, but then once the baby is here, again things will be like, haywire. There'll be so much of added responsibility, such a lot of confusion. So having your partner with you in this program is going to be really helpful. Okay, because this knowledge is equally required by both of you. Okay, so that, like, something is happening, to me, my husband should be able to understand the way I'm communicating to him. Maybe I will not even be able to communicate to him in a proper way. I'll not be able to form my sentences or structure them so well that, I'm planning and then I'm talking to him. But then if he has attended the program, he will definitely understand, yeah, this is what is happening, this is something that is expected, it is not something unnatural. If I'm saying that, I'm not interested in having your mother around when I deliver my baby, I want my mother around, normally it may lead up to a fight, that why are you talking to about my mother in that way. But then it is very natural, because I should be prioritized. If I am having the baby, it's my baby, my life. I have gone through so many changes. It should be like, I should be the one who should be allowed, or who should be given the responsibility to take decisions. And then having a supportive partner is equally important, because if you both end up fighting, there's no point. The entire thing is going to be a big mess, because y'all will end up quarreling with each other. So it is, yeah, it's really important for the partner also to be a part of this program. We highly encourage that.
Yeah. My next question is, see, I feel after attending the program, both mother and father will be, they'll feel a lot lighter and easy to approach doctors regarding their issues, whether it is related to physical or mental. So what is your take on this, Dr. Ruhi and Dr. Rupali?
I'll go. Okay. So, see, in the physical aspect, it's very easy. Look at her, all her extended family. I know sometimes, there will be a sighted issue. If she won't pick up the call, they'll call me and then they'll say, "Arey, usko ye report bhej dena, usko check karna hai." Right? So I'm like,
Okay.
I know that I'm not the expert here, but I have done MBBS, so I know basic. But even for the smallest thing, it's it's a comforting thing to have a physician on your side, and they'll easily tell her everything. And sometimes I am like her PA, sending her, the reports. Ke, yaar, uska ye ho gaya, to dekh lena. They are trying to call you, and you are, of course, she's busy and she's not able to take it. Going to a mental health practitioner, One is, of course, the stigma associated. Second is not just what other people think about you, yourself has apprehensions, right? When a
Right.
patient comes to me, half of it is कि यार society क्या बोलेगी. With every patient, the 10 minutes are just about convincing them that, if you're taking a medication, don't worry about the side effects. Don't worry, it's not going to be for lifetime. This and that. It takes so much convincing more than treating the patient. I think treatment part takes much lesser time than as much it takes to convince them that they need a treatment or it's okay to take the treatment. So that is the aspect. So it's very difficult, but yes, having communicated with them, understanding where the doctor is. So I just tell them that if you are scared of psychiatrists, I'm just a 5 foot girl sitting in front of you, right? If I remove the tag of it, I'm pretty sure that you'll be having a decent conversation. But yes, with being a psychiatrist, it takes a lot of stigma. The version changes. I know even in my family, the way they talk to me changes a lot. Sometimes they feel that I'm diagnosing them at every point, which doesn't happen, but maybe it does. I'll keep that as a secret. But this is,
It does.
the confusion that is associated with it. I have to keep up. What is that called? That you have to keep that face,
Zen,
that mask on.
Zen
Yeah,
mode.
so it's easy to go to a doctor, a physical health doctor, because it's just there. But with the mental health, of course, it becomes the whole trauma of going to the doctor itself is so much, let alone, the trauma of having that illness and getting the treatment. So yes, it's difficult, but that's what I'm hoping. And the reason that I do so many live sessions, the reason I, talk a lot, which is not a part of my regular job, I do it because I wish and pray. It's not necessary that they come to me for treatment, but it should give them that confidence. It should give them that comfort, that it's okay. They are human beings sitting on the other side and we can talk to them and that's okay. So that's the reason that I feel that it's important that more and more doctors come and talk about their own expertise, because it will help break those barriers. We have that hesitation in going. So I think it would help in that way. Plus added, I think we'll coordinate our clothes. That will help.
Yeah.
Yeah.
So for me, I feel that why the people will be more lighter once they're done with the workshop again goes to the beginning of the session, that they will be having more knowledge about what is going to happen to them. So they won't be that anxious, because when do you get anxious? When you don't know certain things about anything that is happening with you. When you're clear with everything, then you are much more comfortable. Obviously, you have to go through that journey. We cannot do anything about it. The only aim is that it should not be a traumatic event of your life. It should be a cherishable moment of your life. That is what the aim is, to do it. Otherwise, I feel it will definitely help all the people who will be joining. They will be having better idea about their body, their mind, and the fact that mind and body together are coming this time. So we are covering the entire thing. Nothing will be left out. So they don't have to go to a psychiatrist. If the lady will come to me and she's not having anything, she's just having anxiety, so she does not have to go to a psychiatrist and find her on the internet. She can directly go to Dr. Ruhi and it will be sorted. That's so easy. So that is the best part of this workshop, I feel.
Yeah, completely agree with you, Dr. Rupali.
Yes. Nilufa, you take up the next question.
Okay.
I think we are almost done with the
Yeah, we are
questions.
done with all the questions. Okay.
Yeah.
Done with all the questions. Yeah, we covered everything. Yeah.
So I
Okay.
just hope all the people who have been viewing it, they understand our need. Why are we doing it? We really want healthy mothers in the world. We really want that there should be sound minded mothers who take care of their child very well, because this is the future generation that we are raising. So it is a huge responsibility that is there on our shoulders. So it is time we take it a bit seriously. Happily but seriously.
Yeah.
Yeah.
Right.
Very
Yeah.
well said.
Yes, exactly. We have covered all our questions. I am just I just want to conclude by saying that I'm extremely happy and excited for this program. Okay, and I really deeply wish that it will truly help the women
Yeah.
who will be attending it to live a happy life, throughout their pregnancy and after their baby is here. Because I really wish that, that is the one wish because of which I actually started New Mother. I was, New Mother started mainly for, focusing on the postpartum period, because that was one area which was completely ignored, especially the mental health part, and nobody talks about it. People don't know. People are pregnant, they are very happy, they're happily going through their life, preparing, creating nurseries for the babies. It's all important. Having photo shoots, all that is important, definitely important. You have to do whatever you feel like doing, whatever makes you happy. But then, we are just missing out on the most important part. We think that, oh, classes, oh, preparing for postpartum period. I like, why? Like, kind of, because that awareness is not there. Although, yeah, nowadays there have been, many people screaming on top of their voices that this is important, and we are among those people. We four are among those people. So there have been people, but then, still our voices are still weaker compared to, the majority of other voices out there. I just wish that our voices are heard. Okay, it
Yeah.
is for the benefit of you. Okay, and trust me, you will not really realize what exactly it is until you face it. And what we are trying to do is, having you avoid to face it. We don't want you to face it. We don't want you to get into the negative part. Okay, definitely there will be problems. As I said earlier, you may have problems. You may end up having problems. Okay, different kind of problems. But then what will be very important is that you will know what to do, right thing to do. Okay, if something is happening to you, you will not sit and think, or you will not just go and talk to your friend on call and say, and then she will say, oh no, this happens, it's okay, it's not a big deal. So it will not be like that. You will have that knowledge to decide for yourself that what is the next step I'm going to take. That is very important, knowing that. And then, you will know that help is just one click away, or just one call away. If you really feel that, yeah, there's something wrong, I want to talk to an expert, I want to talk to a doctor, you will know that, yeah, I have to do this. Okay, you will be in your right state of mind. That is the entire purpose of having this program. And I'm really happy and excited. And as I said, I just wish that it helps out many, 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 many women out there.
Yes.
Right.
And thank you. Thank you so much for joining us this live session, and for Mindful Motherhood, Dr. Ruhi and Dr. Rupali. And yeah, we are so excited for the first workshop.
Same here.
It's
Same here.
feeling
Yeah.
is mutual actually.
Yeah. Yeah, so everyone who joined this program, who are watching us, joined late, who will be watching this session later on, we will be uploading it on YouTube as well. And we will also be sharing, we will update the details about this program. Okay, so we will have that done. And if at all you have any queries, you can approach any four of us. Okay, so we will be having all our Instagram account links in the post itself. You can approach any one of us, you can DM us. Okay, and then we can definitely talk further if you have any queries or any doubts. So feel free to reach out. Reaching out is the first step. First step you can do to help yourself. So do it.
Yeah.
Okay.
Thank you everyone for joining us.
Thank you so
Yes.
much.
Thank you so
Thank
much.
you so
Have a nice
much.
day. Yeah.
Yeah, you
Yeah.
too.
Good night.
Good
Bye.
night. Bye.
Bye. Bye.